Hello, this is Dr. Robert Davis sitting here with another patient of mine that we took her through the whole process of removing the teeth, making immediate dentures, making a follow-up denture, placing 4 implants on the bottom to retain the bottom denture, which is called a lower IRD, implant retained denture. And we're about 3 months past attaching the dentures to the implants, and we want to show everybody what we have, what we've done, and listen to her a little bit. So we're going to both look in her mouth, look at her smile, and then she's going to be able to, I'm going to shut up here in a minute and let her talk. Okay, now then, would you bite down? Just bite down and smile as big as you can. Okay, that's what we ended up with. This is an upper conventional denture. No implants on the upper, only because we haven't gotten around to it yet. The lower is a lower implant retained denture. Now, tap your teeth. Okay, now then, I want you to go ahead without using your hands, take the lower out.
I can't.
It won't go out, okay? Now then, over the 3 months since we've attached it, you've been wearing the lower denture all the time? Or have you had to take it out during the daytime?
No, I wear it during the day and I take it out at night.
Okay, you take it out at night, clean it, and sleep with it out.
Right.
When we take it out, I'm going to show you how nice and clean she keeps this. And this is what I like about this procedure. It's removable, but it only comes out when the patient wants to take it out and clean it. Or they just want to take it out just to do without. But in a social setting, they're never going to do that anyway, as long as they can wear it without it hurting. And the big advantage of this over a retained or a fixed hybrid bridge or a fixed denture prosthetic is the fact that this is removable, therefore it's cleanable. The others are very difficult to clean. The other advantage is it costs well less than 50% of what the others do. And so there's a big advantage. Now then, what I want you to do is I want you to go ahead and take the lower one out. I don't know whether the sound of that came through on the video or not, but you could hear a definite popping, and that's the retention. Now let's take a look at this. I'm going to show you this. This is what we have. We have 4 implants. This is the bottom. We have 4 implants, and we have these little blue snaps. When we start and convert the denture initially, we start off by putting black transfer implants in, and then we generally bring the patient back 2 or 3 months later to switch those out to the more retentive blue snaps. Now these snaps are not permanent. These snaps will wear out, and usually they last 1.5 to 2 years, but actually I think they last longer than that because I don't have very many people come back short of 2 or 3 years to have them replaced, and it's not an expensive or a difficult process to do. Again, the big advantage is she can take this out and she can sleep with it out. Now I want you, can you get that in there? Can you, are my fingers in the way?
No.
And you can see the 4 golden colored attachments here. These are called abutments. This is what the denture is attached to, and these just stay there. Is it not that? No, that hurts you, does it? Okay. And now then, let's go back in and let's get real close again because I want to hear the snap. Pretty subtle. I don't think that.
Yeah, I don't think
sound.
you heard that one.
I don't think. Now bite down on it. Okay, is it in right?
I think so. Yeah, I believe
Okay.
it is.
What generally we do is we put them in and position them, and then after they're positioned, they work just a little bit like she just did, so that she can just fully seat it. Sometimes you hear the snap, sometimes you don't. But the thing is, does this feel like it's coming out or it's loose?
No.
Is it hurting you any place?
No.
Has it been hurting you since we converted this lower denture?
No.
Okay. All right, and we can't get it out. So when you're at church singing or at home yelling at your husband or whatever you do.
That's probably enough.
You don't have to fess stuff in.
Okay.
It doesn't come out except when you want it. That's the goal.
Right.
It doesn't come out until the patient wants it to come out. Then they can get it out and they can clean it. Take it out one more time. I forgot to show everybody how clean it is. This lady is one of my champion denture cleaners. That's as clean as the day we made it. That's the way they should be. And that's the nice thing about it, because we don't build up plaque and tartar on the teeth or underneath, because she can clean it every day. Okay, you can put it back in. Now then. If I would tell you that I'd buy this back from you and take the implants out and take the attachments out, would you agree to that deal?
No.
You wouldn't? They're yours now, huh?
That's right.
Okay. So tell me about how you are you able to eat most of the foods you want to?
Yes.
Okay.
Since I had the implants.
Since you had the implants and had the denture
Mm-hmm.
attached. Now that we could also do 4 on the top, and the palate of the top would be cut out, which helps with tasting food. It helps with diction. It helps with singing. It's a very big positive. But right now, what's happened by doing the 4 lower implants and the lower denture, we've made the lower denture the strong link of the chain, and now the upper denture is the weak link of the chain, because the fact this stays in so well, the upper denture, which everybody who's a denture wearer knows that an upper denture stays in better than a lower denture. Well, now because of doing this, the lower denture stays in better than the upper. Is that correct? Is that a fair statement?
That's
So
right.
she's having to wear a little adhesive on the upper to keep it in because of this, because the lower will stay in. Okay, thanks a lot. I
Thank
appreciate
you.
it. So I hope you're happy with that.
I am.
Good. I'm happy with it. Good.
Okay.
And
We
she's
did
gonna
good.
come back someday, and she's gonna get those 4 uppers, aren't you? You don't have to commit
Yes.
to that. Yeah. Okay. Thank you.